Hi friends, we will be doing part 2 of Staphysagria, and we will see ailments from what affects Staphysagria so much that he goes and gives extreme kind of reactive patterns, and the reactions we will see along with ailments from number one, ailments from after being abused sexually to the extent, not as we saw in the first video. Sexual doesn't mean that he has to be raped or physically being abused at the level of sex, but it means that a person loses his identity. A case I had shown in PCOD seminars about a lady who was the daughter, and she had further sisters, and her father did not remember her name also when she grew up. Means that kind of mortification, indignation or abuse she feels about her identity, that my father even doesn't remember my name. I mean, what kind of identity I have in my own house? Because I have more sisters lined up doesn't mean that I don't exist. So that anger is there, that pent up anger she has about her father, and she carries this kind of this kind of experience, and it multiplies. This experience multiplies. Then she faced similar situation at her husband's house, where her husband did not allow her to do anything. He did not give her any freedom. She did not have the freedom to even meet her friends, to talk to her parents over phone, to visit anybody's house. So many restrictions she was bounded to. He even used to hit her, and that violent act used to happen at home. And then she took a divorce. That too, her parents did not support her for this kind of divorce. It was known that her father-in-law was a rapist, and he was having a criminal action going on. Police was behind him for that kind of criminal act. So she wanted to come out of this kind of relation, which she was not allowed. She was denied. She suffered from hypothyroidism, diabetes, PCOD and anemia. Her hemoglobin levels used to be just 6-7 since her childhood. So to so much of depth she feels that my own father does not support me, my own father does not understand me. So this abuse goes to that extent, where it is repeated daily, day in and day out. A girl is feeling that torture. The girl is feeling that I am not being valued in my own house. I have to struggle for my existence. I have to study, take tuitions, earn my own money, because my father refuses to give me pocket money. So that is how she carries that sense of mortification with indignation. And single staph is there in ailments from mortification with indignation. Another case I remember of a lady, and she was suffering from excessive leukorrhea. Okay, and excessive leukorrhea psychodynamically correlates to having excessive sexual desire. So she was a newly married lady, newly married in the sense it was around 2 years of her marriage, and she was a young lady. Okay, now she used to wear those typical salwar kameez and gum, and she stayed in a very nice, very hep society, and her mother-in-law used to come in very tight fitted jeans and top. So it was a reverse combination. A mother-in-law generally is wearing Indian outfit and a daughter-in-law wearing Western outfit, but it was reverse in this situation. And I used to wonder what kind of this thing is there, where it is not looking a proper match. So then she told me that my mother-in-law is so dominating that she has complete control over my husband, and for this reason I don't like to be with my husband, I don't want to have a child also from my husband, because now the situation is that everything that I do is as per my mother-in-law, and after I have a child also, my child also will be controlled by her. Everything of my child will be decided by her. So rather than having such a motherhood, it is better I don't become a mother. So it was to this gravity that she felt, that mortification with indignation. That's an intense feeling of shame, intense feeling of what you say, embarrassment, felt very, very internally. It is very much internalized. Embarrassment is a feeling of, it is Staphysagria is also then ailments after embarrassment, where they don't like that their weakness getting exposed, or something which is not acceptable to society is seen to people, which is there in him. He doesn't like it. So by mistake also, little strap seen from here, by mistake also there is some spot on the shirt or on the pant. That is a very serious offense for him, that how could this be seen, and he takes it very internally. So this kind of ailments from is there in this staff. Then there is also ailments from reverse of fortune. As we saw in the first video, the fortune is very nice, a child who's being pampered, who's being given lot of love, care, and everything that they demand, their obstinacy getting fulfilled, their jealousies seeing the most what they can get out of seeking that attention. And now you see this kind of situation comes where things just reverse, and he's been withdrawn of everything that he was provided with. So imagine a person having that kind of egotism, that low, that tall, and that enlarged feeling, and then everything comes down. Ailments from loss of job, ailments from fear to lose his lucrative job also has staff. Nowadays the situation that is being going on, ailments from position loss of. So a person who was having a good position in society, a person who was earning well, who was given good dignity and respect, now something happens in the house. Suppose a child has committed some act by which the father takes it internally, that how could my child do this? How could my child be caught of a thief, or a act like smoking or drinking, or doing a wrong act with a female? So the elder person of the house, if it is staff, that person takes it internally, that I have lost my position, I have lost that dignity that I kept hold of in the society. So this is something that affects staff a lot. And then there is ailments from moral excitement. Now I'll tell you one case of a young girl. Okay, she's just in 7th or 8th standard girl. Now this 8th standard girl, she used to be in the state. I have shown her case earlier also. She was in another phase of the remedy, and she was suffering from a very serious problem. So she came out of that state with that remedy. Now after a gap of 1 year, her state completely changed. Okay, she was a changed person, and she became more mature and more understanding, and how much effort. So she was in the state of spongia at that time. Then later on she became a very composed girl. Now what happened, that she had a crush on a boy in the class, and she had a crush on the boy in the class, and she came home and she told her mother that, Mama, I like this boy a lot. Now her mother was in impatience children about his. Okay, she could not tolerate that you are going to school to study. How can you just say that you are having crush on a boy? It's a complete offense. You are not supposed to do this. And what kind of feeling are you having? You're going to school to study, or you're going to seek or have crush and this and that. She bombarded her with lot of offensive words. And this girl, she internalized that thing so deeply. This is ailments from moral excitement, that I have to do everything that is morally correct. How could I do this if this is not morally accepted? Morals is, I've done in detail about morals in the video of Ignatia. So morals is something which the society accepts, something which is right, which you have to select between right and wrong, and you want to go towards what is right. Right is something that majority of people accept, that this is the right thing, this is the good thing that you should do. That excitement is there in Staphysagria, that I should not do anything wrong, nothing should go wrong by my hands, or no negative or wrong thought should come in my mind. That moral excitement makes Staphysagria very, very restless. And this cough she was having for almost 1.5 months. I repeated Spongia, it was not helping at all. I put her on belladonna because I thought she's still that playful. It was not helping at all. Then I called her in the clinic and I told her, you need to see me, otherwise I cannot treat you. So when she came over, she told me, doctor, in person, when she was alone, that in front of mother she never spoke a word about this topic. And then I understood that this is her problem, this moral excitement, this kind of sensitive to moral impressions, that is affecting her. And her cough went away within minutes to hours, a chronic cough. So this is how Staphysagria you will find very often in your clinics, because that is the age, you have to understand that age where a person or child also needs to bond. So parents have to deal very sensitively in this age group. Now, the similar kind of ailments from is there in suppression of writing left-handed. So again, left-handed, your emotions, your feelings, when it is suppressed, when you just tempered with that, you cannot do this, you have to just you have to shut these feelings out of, to remove this feeling. So Staphysagria, it goes into that anxiety mistakes about he feels it is my mistake, I have done it. Anxiety, anger mistakes about anger himself about, and anger with complaints in abdomen again, something you can't digest but you can't remove from your head also. Anger from paralysis on one side. So I had a case of a lady, she was elderly lady, a widow. Okay, now being a widow, she had 3 daughters and 2 daughters staying abroad, 1 daughter staying in the city itself, but at a distance from Kandivali. She stays in Malad. So now being alone in the house, her husband just passed away last year, and suddenly she developed Bell's palsy. So one side paralysis happened. I don't practice on physicals at all because I don't know, I can't remember them. So what happened was that she suffered from Bell's palsy and she contacted me. Hey doctor, one side is not moving and this and that, and she sent me her pictures. I told her, auntie, don't worry, you just come and talk to me for some time. So she came over and she told me that this is happening, and I told her that what happened. So her daughter is called up immediately and she started scolding her. Where are you? Why didn't you come at my home? What are you doing till now? You see your face, you send me pictures. So she's telling her very, very softly, very, very politely, and she's telling, I have come to Dr. Pallavi. She's a homeopath. I take homeopathic medicine from her. So I will see her and then. Why did you go to homeopath? What is the need of homeopathy over here? You need to just come here. We will go to the hospital. We will show to the specialist doctors. And this and that. So, and her expression is, okay, I'll come out from here and then talk to you. I'm like, my God, auntie, you are having Bell's palsy, you have suffered from paralysis and your daughter's still scolding you. And you have come out of diabetes with the homeopathy, you have come out of hypothyroidism with homeopathy, and still she doesn't trust you that, homeopathy can help you in this. she's like that only. She just keeps scolding me, and because I'm alone over here, and she feels very anxious about me, and that is why she wants to keep me under control and this and that. So I told her, okay, fine, you first take Staphysagria, because that was the thing that she needed that time the most. In spite of taking all the hurt, the resentment, she's not reacting to it. This is how Staphysagria is. That is why it is there in honest. Honest meaning what? The person talks honestly. Honestly meaning he convinces himself that I am telling the whatever I feel is right, I'm telling you, and that kind of expression is seen on the face. So there's a difference in truth and honesty. Truth is something, truth is a reality which everyone can feel, but honesty is something which the person feels is right. Okay, so this is honesty seen in Staphysagria. Loyal in relationships, they will not break any relationship, they will not be this is the kind of commitment they hold to their relations. So this is kind of expression. And then anger with respiration difficult, with constriction in throat pit. The voice gets affected in Staphysagria. It is there in the with complaints of voice. So because they can't speak up for themselves, the anger which they have, we will do this in detail again in the next video. Anxiety from masturbation, practicing something which they seek pleasure about, and then they feel anxious that no, this was not allowed to me, or this is what people don't like, so I should not do it. So this is the anxiety which they carry, and there is lots and lots. We will further continue in the next video. Do like, comment and subscribe. Thank you.